Now we're going to see the deficiency of factors, of coagulation factors, or the hemophilias. We have deficiency of factor 8 is called the hemophilia 8. Factor 8 deficiency is hemophilia A. Factor 9 deficiency is hemophilia B. And factor 11 deficiency is hemophilia C. These two are X-linked diseases, and this is the autosomal recessive disease. This usually is asymptomatic, sometimes could present with bleeding in after surgery or something like that, and in that case we do treatment, but usually there is nothing to do with this because it's asymptomatic most of the times. Hemophilia A is far more common than hemophilia B, and the presentation correlates with the degree of deficiency. If the patient has mild deficiency, the bleeding will be seen after surgery or trauma, and if it's a severe deficiency, will be seen as spontaneous bleeding from the brain, cerebral hemorrhage, or retroperitoneal hemorrhage. For example, if the patient has factor levels less than 5% and greater than 1, this is a moderate deficiency, and if it is above 5%, is a mild disease. The best next step that we need to take, or the best initial test, is after a bleeding, we always ask for the complete blood cell count and the times, the partial thromboplastin time and the prothrombin time. Because factor 8 and factor 9 and 11 belong to the intrinsic pathway of the coagulation cascade, the PTT would be elevated. But this doesn't distinguish between hemophilia A or hemophilia B, so the next step is a mixing study. The mixing study is, it could be for whatever of these two. We mix the patient with hemophilia, we mix the plasma with a plasma of a normal patient, and if after this we see coagulation, that is that the clotting factors of the normal patient are acting on the plasma patient of the hemophilia patient. And so that we know that is a deficiency of the clotting factors, and this correction would be seen as a normalization in the PTT. This is a mixing study, and this is what we usually see in a hemophilia patient. But sometimes after we do the mixing study, we do not see an improvement in the PTT, and this could be also hemophilia, but it could be because there is no deficiency of clotting factors. Instead, we are producing an antibody against the factors, and so the antibodies will also attack the clotting factors of the normal patient in the mixing study. So we would not see an improvement in the PTT. And for specifically know if it is a factor 8 or factor 9 deficiency, we do specifically testing for that. We can treat for hemophilia A with desmopressin. If it is mild, we treat it with desmopressin because desmopressin will release the storage of factor 8 in the endothelium. And if it is severe, we treat it with factor 8 replacement. Factor 9, we will treat it with factor 9 replacement. Sometimes we can treat for factor 8 deficiency, and if it doesn't work, then we treat for factor 9, because the most common hemophilia is hemophilia A, and if don't, then would be hemophilia B. Hemophilia B is also called Christmas disease because it was discovered in Christmas time, and hemophilia C is mostly asymptomatic. Sometimes genetic consultation would be appropriate because if the parents of the patient want to have another child. And deficiency of the clotting factor 13. This clotting factor stabilizes the plug that is already formed after fibrin, etc. And this usually could be asymptomatic sometimes. The way as we are going to see it is with a SM urea test. This dilute the clots that are not being stabilized with the fibrin, so we will dilute the clots of the patient with deficiency of this factor, because deficiency of this factor means that the clots are not being stabilized with the certain factor. So it's a urea test, and the bleeding of hemophilia is a deep bleeding, for example, in amarthrosis or things like that, not a superficial bleeding like in platelet deficiencies. It is not just mucosal or skin, it's deeper. And sometimes the patient presents with joint deformities because the hemosiderin of the hemolysis that is deposited in the joints, and fibrosis.